Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat. I'm a big fan. If I have a social media of choice, it's LinkedIn. I meet all sorts of interesting characters on LinkedIn, one of whom is with me today, Drew Tootal. We got connected on LinkedIn, and it's always interesting to see what people have done before, what they're up to now. I messaged him and said, "Oh, Drew, I'd love you to come on the podcast," and he was very agreeable to do it. I think partly because we're also alumni. We're of the same great vet school at Liverpool. So great to have you on, Drew. And I'll let you introduce yourself. Obviously, you're a vet, but tell us a little bit about the history since you started in the profession.
Well, first of all, thank you. Thank you for the invite. I think I had maybe a slightly different career path than many. I come from a military background. My family, my father and my grandfather were both Air Force. So I became interested in the military, and I heard about this organisation called the Royal Army Veterinary Corps whilst I was at university and looked into it. Graduated in 2004 and then joined up with the REVC a couple of months later with the express intent of doing just a short service commission of about 4 years and then going. I actually wanted to be an avian vet. That was my big love, and ended up staying on for 17 and a half years, doing all sorts of weird, and wonderful things. But I think the key thing about it was for me was, and my biggest love was the working dogs. So I was really, really lucky to be able to spend the majority of my career working with them, deploying with them. I did 2 tours as the officer commanding of the veterinary training squadron, which is like the centralized services veterinary hospital. So yeah, my love, my background has been working dogs, and it's been, I guess, really a very proactive approach to keeping healthy dogs healthy. So lots of monitoring, lots of early interventions, early pickups, and then making sure that when they're ready for retirement, they've got a retirement worth having. So they get a good, long, fulfilling retirement as well as career. So yeah, that was the bulk of it. And then a little over 3 years ago, I left the services and came to work here at MSK Vets.
And MSK Vet's obviously a part of the Nupsala Vet Group. Tell us a little bit about what Nupsala gets up to, because I've obviously seen them at equine conferences at Beaver and so on, had a chat with them. But it's quite an interesting organisation, isn't it?
It is, and it like many things has evolved over the years. So when Uppsala was set up, it's primarily a pharmaceutical wholesale distributor. But because of the background of the people who set it up, it's been ostensibly equine based over the years, and largely to do with arthritis management. So, with special focus on the use of, or the development and use of orthobiologics for arthritis management, but also other musculoskeletal conditions in horses. So, we're talking about things like stem cell therapies, PRP, hydrogels. And then over time, there's been I think, a slow shift within the companion animal profession, that all of this science, all of this technology is eminently translatable. So the MSK Vets was set up really to start to almost practice what Nupsala preaches. So talking about orthobiologics in horses, etc. Now we're actually doing it, but we're doing it in dogs. So we focus on largely on mobility cases. That's probably the bulk of my work is in arthritis management, but some other sort of various bits and pieces along the way.
And sticking dogs on treadmills and so on.
Yeah, absolutely. So that was a really that was a pretty big learning curve for me right at the beginning. So we're very lucky. We've got an instrumented treadmill. It's the same software, the same kind of detection as they use for gait analysis in athletes, in runners. But obviously the algorithms changed from 2 legs to 4, and it provides you pretty quickly with a huge amount of data, and a lot of that data is people will recognize from things like orthopedic outcome studies. So things like peak vertical force, vertical impulse, symmetry indices. And what we do with that, the gait analysis doesn't interpret anything for us. It would be great if it did a sort of ping at the end and this this dog has
People
a,
appreciate. Yeah.
that would be great. That would make my life a lot easier. But sadly, it doesn't do that. But what it does is it provides us a mobility baseline.
Yeah.
So a bit like an X-ray is a snapshot of structure on that day. The gait analysis is a snapshot of mobility on that day, and we use that to baseline and then apply interventions. And that intervention might be as simple as weight loss and physiotherapy, or a new
Yeah.
drug protocol, or it might be sort of my particular area of focus, which is intra-articular therapies. And then the rationale is that if nothing appreciable has changed from your baseline to to your intervention to that first repeat gait analysis, the only thing that could have made a difference to that dog's mobility is the intervention.
Yeah.
So you can track the change, see the improvements, but then inevitably in these cases that we're dealing with degenerative conditions. So we're looking for improvement, but we're also really keenly looking for deterioration as well. We don't want them to go all the way back to where they were. So we're trying to see if there is subtle things starting to sneak back in that might prompt a revisit of the therapy or consideration of something different.
And I'm going to accuse you of speciation because you only look after dogs, but I presume you can't get cats to run up and down a treadmill, can you? Because that's not what cats do.
You can. It's very funny, but scientifically not very valid. So there is good validation for dog data, but the with cats, it's interesting rather than useful.
Yeah.
But I think yes, speciesism does come through a little bit, but I think that that's just at the moment just been our kind of evolution, if you like, as we've accepted these technologies. So this is a really emerging field, especially in orthobiologics. So as we've seen these things come in, we're trying to adapt and integrate. And I think not because of any direct sort of targeting or anything like that. It's simply that with dogs, people are more acceptant of the idea that they are developing arthritis, and they will look for solutions. Cats, we absolutely recognise it's possibly even a bigger problem than with dogs, but it's so hard to get people to accept
Mm.
the issues in dogs, and for people to then, for them to get themselves referred to us.
Yeah.
It's even harder with cats. So
Yeah.
we're just sort of going through some changes at the moment, and then probably next year we'll have another big push and go out there and start targeting cats, because from the science application in terms of the management of musculoskeletal issues, it's synovial joint is a synovial joint is a synovial joint to a
Mm.
certain extent. So the science is absolutely translatable as well. But we just need to get out there and start banging the drum.
The first series of webinars that I did back in 2010 were with Hills, and it was feline. And Duncan Lascelles gave a talk on feline osteoarthritis, and he said of all the conditions you've looked at, dermatologists, dentists, etc., osteoarthritis is the most common problem in cats, because once you get beyond a certain age, basically every cat has arthritis. But of course, they don't always want to show it, so they hide it much more effectively than dogs, don't they? Dogs want to look a bit pathetic, so you make a fuss of them, I think, sometimes.
Yeah, whereas cats are so, they're stoic and they hide it, and they're masters at hiding it. But I was just chatting to a colleague last week who's been injecting cats, large and small, from sort of domestic to leopards, and intra-articular therapy has just changed their lives. It really has. So we're really interested on really keen on pursuing it. But I guess military working cats never really took off as a concept in the army, so I don't have a whole lot of experience there.
Yeah, you're more experienced in the dogs than in the cats, and I
Absolutely.
suppose all sorts of injuries that develop there, and such. beautiful animals, but
Yeah,
also, expensive animals that had a huge worth, as all the jobs that they did.
absolutely. I mean, in terms of a dog's ability to detect a hazard that saves human life,
Yeah,
you can't put a price on that. They are it's incalculable.
yeah,
But there is a sort of maybe a pervading thought process that military animals, in particular military dogs, are yeah, their issues are kinetic and to do with war fighting and all of these sort of
mm.
very Hollywood type thing. It's not. It's
It's
arthritis.
normal stuff. Yeah,
It's cancer. It's inflammatory bowel disease. It's atopic dermatitis. It's all these things, and we worked really really hard to try and base our procurement protocols to weed out as many of these dogs as can. But it's not a crystal ball.
yeah,
These animals can go on to develop, and some animals we know, some dogs, they are predisposed to certain conditions like degenerative lumbosacral disease if they are doing protection type work or police type work. We know that's the case. So in those situations, what do? Well, you can't just do rest and anti-inflammatories. So you need to be a bit more proactive, really getting in there early. And it's that kind of old adage, isn't it? An ounce of prevention is worth a pound of cure. I think maybe one of the sad things I see on a almost day to day basis is this normalization of osteoarthritis in companion
yeah,
animals. It's to be expected. We know it's coming, and we'll just empty the pharmacy cupboard on them, and just and it's just so
mm,
sad. We don't need to accept it. There are so many options now. One of the areas that I focus on is, as I've said, is orthobiologics. But
yeah,
I spend a huge amount of my consults actually educating owners on
yeah,
everything from weight management, exercise management, lifestyle management, educating them about what their dog's condition is, what it means, what they can do, what they cannot do, what to expect. There's just a whole raft of information, and when we're talking about these management cases, it's multimodal management.
yeah,
Of that, multimodal analgesia is just a part. So that's
yeah,
what people tend to go, well, osteoarthritis, multimodal analgesia, that will sort me out. It doesn't. You've got to take the bigger picture.
yeah,
And that's what we try to do, is take a very holistic approach. And I think that one of the nice things about the gait analysis is it forces you to take a step back. You
mm,
don't get seduced by the elbow that's the size and shape of half a grapefruit, and go straight to that. And that's what we're focusing on. You take a step back and go, what else is going on?
you look
Anecdotally,
holistically.
yeah, absolutely. Anecdotally, more than 50% of dogs that have got elbow dysplasia will have concurrent shoulder tendinopathy
Yeah,
because of the loading. So you need to look for that. Otherwise, you end up doing some very clever things into the elbow, and the dog doesn't get better. And
yeah,
why doesn't it get it better? Because you haven't addressed the primary issue.
yeah, yeah.
So I think there's lots of things out there that lots of sources of information that we need to be looking at.
I remember early on in my career being invited down to the Natural History Museum for the launch of Carprofen, and it was great to see that because of course even before that, sometimes even with operations like a bitch spay or a dog had had an orthopedic operation, it was, oh, don't give them any pain relief because we don't want them to move. So the analgesic has created a revolution. But you're quite right. I remember on numerous occasions where I would see a fat Labrador coming in, and they'd say, "Well, okay, carprofen is or meloxicam or whatever you wanted to use is part of the solution, but you have to get you have to get weight loss out as well. If that's a overweight Labrador, it's not going to get better until it loses the weight." Tell us a little bit about, obviously you've got the kind of medical side, but I think there's also a huge behavioral side to osteoarthritis. If an animal's in pain, you will get grumpy dogs in who just really, and cats who don't want to be touched because they're sore. Do you see that? How do you go about it if you've got an animal that's coming in that really is, not keen on you examining it?
Yeah, this was I think this is probably an area which I didn't see coming, if I'm
Yeah.
honest. But it's an area that's developed, and it's an area we've become quite adept at managing, and that's behavioural cases. So there is an absolutely undeniable, unequivocal link between pain and behaviour in companion animals. Anybody who says otherwise needs to educate themselves really strongly and immediately.
Mm.
So, one of the issues that we found was dogs which were coming to us saying, we think this dog might be in pain. Very often it was at the behest of behaviourists, speaking to owners and going, "I think your dog might be in pain. Why don't we go speak to MSK Vets to see if they can do something?" And we found that these dogs either they can't safely be examined, or equally can't meaningfully be examined. So a lot of these
Mm.
dogs are so emotionally shut down that they just give nothing away, absolutely
Yeah.
nothing. And then you end up in this sort of difficult position where all you can do is just throw meds at them and see if it improves. And very often the medical protocols are they're just not sufficient, or they're not targeted enough, so you get an equivocal response, and then the decision incorrectly is that the dog's not in pain. So we had to think about this, and we started doing a few of these cases, and found by taking a very hands-off approach, if the dog is worried about the veterinary environment, well, let's make it not a veterinary environment. Let's go do things outside. Let's go and meet outside. Let's do some positive reinforcement. Let's do some treats. Do some bonding before.
Yeah.
We're fortunate enough we're not in that sort of 15 minutes. Got to get a history. Got to get the clinical examination. Got to get the notes done. Got to get the drugs dispensed. Gone. I'll see you in a month. We're not in that position, so we do have the time in these cases to go right. Let's just back up, take it at your pace, and nine times out of 10 in these dogs, even if we can't physically examine them, we can still get them to run on the treadmill. And that's been really eye-opening, because we've seen gait abnormalities and we've seen very subtle things. It's allowed us to go, well, I'm now 99% sure that the dog's in pain, and I'm 80 to 85% sure the problem is around here somewhere.
Yeah.
And that's been really important, because it's allowed us to do a much more targeted investigation. And I can give you a case in point. It was a dog that we were dealing with who was anxious to the point of almost being agoraphobic. She's got bilateral hip dysplasia. We knew that, but it wasn't that bad. Gives away very little on clinical examinations, all kinds of bits and pieces. But we did the examination, we did the run, and just the way she moved and the way she sat and the way she all of these things just shouted out to me, this dog's got lumbosacral pain. So we just said, right, well, let's test that. Let's just see again that idea of baseline, intervention, assess
Yeah.
response. So we got the baseline. We did a trial epidural steroid in her, and within 10 days, the dog went from not going outside to dragging her owners down the garden path, dragging them around the village, jumping in the car, which she hadn't done in I don't know how long, going out on walks. And the only thing that had changed was that epidural.
Yeah.
And that's been life changing for the dog, and for the owners to a certain extent. We've subsequently addressed the hips. Dog's in a really good place. We've got a management strategy, and she's yeah,
That's a lot
everything's
better. And
better.
of course, if you're not exercising as a Labrador, you put on weight, don't you? So the more we can get her moving, the better. Personally, I was speaking to John Innes, who I'm sure many of you know, at Movement Referrals up in Chester, and we were talking about sciatica because I've been struggling with it this year. And of course, they didn't really understand about sciatica, but with CAT scanning and MRI now, it's much more recognised. So there are all these sort of problems as well, aren't they? And I know from experience how excruciating it can be. It's a bit better now, but I think I might need some gait analysis from you if I come down, Drew. So
Run all for Anthony, then you're
yeah,
welcome.
we'll have a go. Yeah,
But it's interesting you say that about sciatica. That's another really interesting
mm,
area where we get a lot of dogs, especially young, sporting,
yeah,
muscular, fit dogs, coming in with nondescript hind limb pain. They have X-rays done. The X-rays generally are normal,
yeah,
and it's soft tissue injuries. And again, we can just be so much more proactive now than going down the, I think it's a soft tissue injury, so we'll just do some rest and anti-inflammatories.
Hmm.
So we now can do targeted musculoskeletal ultrasound. We can do intralesional injections of platelet-rich plasma if it's indicated. We can do so much more, and then combine those findings with targeted rehabilitation strategies. And we're getting those results. We're getting these dogs back from long-term lameness back into work, just by application of science and technology.
So how involved are you with things like platelet-rich plasma, stem cells, etc.? Is that a real main kind of treatment modality now?
So I think the way to think of MSK Vets is almost like a hospital outpatient department.
Hmm.
So in the same way that if you had a soft tissue injury, like a torn shoulder or something along those lines, you would go to your primary care physician. They would do some pain relief initially, do the initial examinations, but then they would send you off to referral, or they'd send you off for a scan, or they send you off for
Hmm.
something. But then you come back to your primary care physician. That's exactly what we do. So things like in terms of platelets and the stem cells, hydrogel injections, things like that. These are accepted technologies.
Yeah.
They are emerging, and we accept that. But there's absolutely translatable evidence, both from the equine field and from the human field as well. And even as we speak, there are papers being published on a almost weekly basis that's supporting new research
Hmm.
into companion animal. So these sorts of therapies I'm doing on an almost daily basis, whether it be for soft tissue injury management, whether it be for arthritis management, whether it be for lumbosacral pain management. What we don't do is those surgical options at the moment, because there
Hmm.
are just so many really, really excellent venues and
Yeah.
practitioners to get that done, but there aren't many people doing what we do, which is the orthobiologics, and this minimally invasive, minimal side effect, if any, but really, really powerful outcomes, and forming part of a holistic management plan. So that's why we focused in this area.
And I think sometimes you see surgeons, and this may upset. I'll be ready for the rotten fruit. But surgeons are very good at doing surgery, and they really enjoy that. But to some degree, once the dog's out of the theatre and has gone home, the sort of care that you're giving is it's rehab, it's all the physio type stuff and these medicines that you're using that are really really important and just improve the outcome of the surgery as well as everything else, don't they?
Absolutely, I've got a huge amount of respect for orthopedic surgeons. I couldn't put up a straight shelf, so it's
Yeah,
not my bag. That's
yeah,
that's that's they do that really well. But for me, if we take, for example, if you take something like a condylar fracture in a dog, so they can have that plated, they can have it put back together, we can get some very good functional outcomes. For me, for a lot of places, that's the end of the story. It's like, well,
yeah,
fractured bone, plate put in, healed, sorted. For me, that's the beginning of the story.
yeah,
So at that point, once the dog has, and I do this with a lot of working and sporting dogs, if they've had some kind of intervention, once they've recovered from that, so there's no point doing a baseline on the dog off the day
yeah,
after orthopedic
yeah,
surgery. We need to wait for bone healing, recovery, graduated rehabilitation. Once they are normal, whatever that new normal is,
yeah,
that's when we baseline, and then we monitor. And through periodic sort of examination and repeat gait analysis, to go, are we actually deteriorating? Should we be taking some joint fluid off this and just seeing if we got a degenerative arthropathy going on?
yeah,
If so, in the absence of gross pathological change on X-rays, but we've got evidence of DJD, well, let's do something about it. Let's try something into the joint and see if we can slow that progression. It's
yeah,
not a cure. Nobody's making that claim, but we can turn a 100-mile-an-hour disease into a 10-mile-an-hour disease,
yeah.
and that's really important.
And it was the same with dermatology. You know, you could have an atopic came in that was really not under control, but that was because it had a fungal infection.
Yeah,
And actually coming to me, treating it with, products to get rid of its malassezia, suddenly it was a lot better. Rarely, sometimes with skin vaccines, you could get a dog almost back to normal. But most of the time, there was some sort of residual itch. But instead of it being 8 on 10, it was 2 on 10. That's, a much more comfortable dog who perhaps, isn't on steroids or on very low doses of steroids or Apoquel or whatever drug, to the benefit of the dog with a good quality of life, which is,
yeah,
our job is to bring good quality of life to the patients that we see,
yeah,
isn't it?
absolutely. And sometimes, it's about acceptable outcomes.
Yeah,
Nobody's potentially going for 100% outcomes here. They going back to absolutely perfect because it's not realistic. But acceptable outcomes that allow an animal to have a fulfilled and fulfilling life.
yeah. Just maybe a final thing, Drew. Obviously, we've worked with a company called Wimber that does prosthetics and so on. Is there a place for prosthetics within all of this work as well? Supporting cruciates,
Yeah.
etc., etc.
This is an area which we are still relatively early dipping our toe into, if you sort of forgive the pun, I guess. The use of orthotics, the prostheses, until relatively recently, certainly my experience with some of the cases in the army that I was dealing with, some of those cases that there was very limited options. It was sort of external supports in a kind of one size fits none type availability. And one of the areas which we've started to explore increasing use of is the Wimber, these custom fitted prostheses and orthoses. Again, it can be a game changer, and it's not a fix. It's not but it absolutely can form a really important part of onward management. We dealt recently with a small little dog who suffered a traumatic tarsal injury. Now, when he walks, he gets carpal hyperextension. His carpus actually breaks over, and it's not really massively uncomfortable on manipulation, but actually when he's walking and when he's running and doing what a 2-year-old dog wants to do, he can't do it because it's just impacting him, and it carries a cost to him in terms of
Yeah,
lameness. So we fitted him with an orthosis to try and limit that, to prevent that kind of breakover, and
yeah.
he took to that. 10 minutes, he was walking like he'd never even had it. Another recent case, we had a little ex street dog or a rescue from Poland who nobody knows how, but it suffered traumatic amputation just below the tarsus. Been with the family, lovely, lovely people. And they just wanted to see if there was something we could do. And he said, well, we can give it a go. We can see if this is. And so we did the measurements and we submitted the scans. And the dog we will be posting about this imminently. But we've got a prototype prosthetic with a little blade on the bottom. So we've got a breakover. And literally within 10 minutes, that dog was weight bearing like it
Brilliant.
was nothing. It
Yeah,
was, it was just absolutely, it just made your heart burst with joy just to
yeah,
see that dog moving normally and going, oh, I can do this. This is quite cool. I remember having a leg.
Mm,
It was extraordinary. The tolerance was fantastic. It is a prototype, so we're effectively sort of beta testing it now and just seeing how she gets on with it, and then we'll get her back and see, just make sure there's no rubs, nothing, that the breakovers. We don't want to incur any kind of problems with it. We
yeah,
want to make sure that she gets to as normal an ambulation angles as possible. And then, yeah, I mean, literally, the world is an oyster. She can wear it on walks. She can cut about with it and live a normal
yeah.
life. So, yeah, things like that are technology.
Coming into the mix, new innovations.
Look at our phones over the last 10 years. How
Yeah,
far have our phones come? Well, technology and all these things is exactly the same. We just need to embrace it. We need to see what it can do with us and for us, and then apply it. And then and just look for these positive outcomes. And it certainly makes you want to get up and go to work in the morning.
And you heard it first on VetChat. Those of you who are listening, unless you get, depending on when this goes out and when your article goes out. But no, that sounds amazing, and it is. Sometimes these are emotive issues as well. Or should we? And I understand it's a supporting structure, but should we be doing some of the processes? But this looks like it's a really low level intervention, but with a huge result for the dog, which is fantastic.
At the basis of everything, should it not always be for all of us, first do no harm?
Exactly. Yeah.
On that basis, if you can, through minimal intervention, make positive
Yeah.
outcomes on the dogs and their owners, then that's a good day at the work.
Yeah, exactly. Drew, it's been great to speak to you. Really interesting to see what you're doing. It's one of our words at Webinar Vet is innovation. So it's always good to chat to fellow innovators. And, I know how busy you are, so I appreciate your time.
Oh, I've really enjoyed it. Thank you so much for the invite. It's been really good.
Thank you, Drew. And thanks everyone for listening. We will hopefully see you on a webinar or podcast very soon. Take care. Bye-bye.